Hello, I'm Bo Biggs and this is Kim Jernigan. We're the co-chairs for the Pensacola 2017 Mission of Mercy event. Welcome to Pensacola. Thank you for volunteering.
This is the signature event for the Florida Dental Association Foundation, and we are so excited to have you take part in this event. We plan to treat 2,000 patients in our community, and we'll do that because you're going to come and help us, and we're going to restore dignity and alleviate pain for many of the citizens of our community. Thank you for planning to be with us March 24th and 25th in Pensacola, Florida.
Plan to have a great time. It'll be a very rewarding time providing care for those in need, but I guarantee you will also have fun.
Go team!
Go!
Hello, I'm Oscar Menendez, Co-Clinical Director of the Pensacola Moms event. I'd like to thank you for volunteering and would like to go over some important information with you. I'm in charge of the clinical treatment areas and would like to go over the manner in which we have it set up. Before the event, you will receive different clinical protocols that are specific to where you volunteered. Please familiarize yourself with these and the site plan so you will know where you are going and what you are doing. The treatment clinic will be in Building 7 and consists of the following areas: oral surgery, restorative, prosthetics, endodontic, pedodontic, hygiene, sterilization, and supplies. The clinical lead for each section should have previously sent you the appropriate information for your section along with other important information that you should know before arriving. After you have checked in at volunteer registration, picked up your shirt and name tag, you will proceed to Building 7. Find your area and check in with your clinical lead who will be there. He will go over the pertinent information with you in respect to handling the equipment, clinical protocols, clinic safety, instrument handling and sterilization, the communication cards that are being used, and emergency procedures. Your lead is there to assist you, guide you, and try to make the event as pleasurable and rewarding for you as possible. That being said, please do follow your clinical lead's instructions. A lot of time and hard work went into them to make this a safe, productive, and rewarding event for you and others. Thank you very much.
Hello, my name is Steve Bryan, and I'll be serving along with Dr. Michael Picos as oral surgery clinical leads at the upcoming Mission of Mercy in Pensacola, March 24th and 25th. First, I'd like to thank all of you for volunteering. Many of you have participated at the events in Tampa and Jacksonville. If this is your first Mission of Mercy, you will be absolutely amazed and want to return for future events. I just wanted to take a few minutes to hit some highlights of the clinical protocols. Rest assured that in several weeks prior to the event, you will receive an email with more detailed information as well as written protocols that will be pertinent to your activities in particularly the oral surgery section. Please try to familiarize yourself with these protocols, but before each clinical session begins, we'll hold a brief orientation in the oral surgery section to answer any additional questions that you may have. The venue for this year's Mission of Mercy is Wooden Middle School, so the physical layout's a bit different than what we had in Tampa and Jacksonville. The event will use several of the school's buildings, and most of the clinical treatment will be set up in the school's gymnasium. We expect to see about 2,000 patients over 2 days, and we can expect that at least half of those will require oral surgery procedures. To that end, we have 32 designated chairs for the oral surgery section, and each volunteer surgeon will likely have 2 chairs available. Surgery instruments and supplies will be provided. Keep in mind that these are donated instruments and often aren't going to be what you're used to working with in your office. So if you do desire to bring some of your own instruments, there will be a separate sterilization area for personal instruments. This year, the sterilization area is immediately adjacent to the oral surgery clinic. As you can imagine, there's a lot going on during the Mission of Mercy event, so I would kind of like to add the caveat that if you're bringing your own instruments, you're doing so somewhat at your own risk. That being said, in Tampa and Jacksonville, I, like many other people, did bring some of my own instruments and really didn't have any real issue. There are a limited number of surgical drill consoles that are being provided. These are non-irrigating drills. If you prefer to bring your own electric drill system, please do so. There are adequate electrical plugs available. Each dental chair is equipped with a 4-hole handpiece attachment, so if you have a surgical drill that's air driven and can use that attachment, please feel free to bring that type of drill. If you're accustomed to working with the headlight, I would strongly recommend bringing it. We hope to have 2 assistants for each surgeon. Mission of Mercy events are a great team building experience, so hopefully many of you will be bringing your own office staff as well. There are doctor's chairs provided, however there are no assistant chairs, so feel free to bring any chairs that would be comfortable and feasible for you to bring. Now, just a little bit about the treatment philosophy of the Mission of Mercy. You know, we're trying to address the most urgent needs of the patients presenting for treatment and to put out the fire, so to speak. It's important that we do a reasonable amount of treatment on as many patients as we can. Each patient will come to the oral surgery clinic with a panoramic x-ray and a recommended treatment plan. This treatment plan can be modified by the treating surgeon. If you have any questions about the treatment plan, please ask your oral surgery clinical leads. This is not like treating patients in your office. Please be flexible and come with an open mind and an open heart. Because of the environment in which you will be working, be careful not to get yourself in a bind with more treatment or more complex treatment than can be provided in a Mission of Mercy setting. There will be no numbing stations this year as at previous events, so all the patients will be anesthetized in their respective clinical areas. After treatment is provided, postoperative instructions will be reviewed by the doctor or assistant. Packages of gauze pads will be available to be dispensed. It will be the job of myself and Dr. Picos to keep patients moving into and out of the oral surgery clinic. Our standard instructions will include recommendations for over-the-counter analgesics. Your oral surgery leads will have printed prescription pads for antibiotics and prescription analgesics to be dispensed on a limited basis, period. Please familiarize yourself with the color code card system that is included in the treatment protocol. Wear comfortable clothes suitable for patient care. You will be provided with the Florida Mission of Mercy t-shirt when you check in on your treatment day. Please make entries into the clinical treatment form in blue pen only, so please try and bring some blue ink pens with you. Once again, more detailed information will be forwarded several weeks prior to the event. We're looking forward to a great Mission of Mercy and serving a population of patients with tremendous dental needs. Thank you again for your support. We'll try to keep things moving as smoothly as possible and make this an enjoyable experience for all. Look forward to seeing you in Pensacola, March 24th and 25th. We'll see you then. Thank you.